Uganda's Ebola response, including Uganda's strong position against the international travel restrictions and the praise from the World Health Organization for the country's efforts to contain the outbreak. We are also going to look at the escalating Ebola situation in the Democratic Republic of Congo, plus the concerns over food security in Uganda, and we shall reflect on the health achievements that have transformed lives across our nation over the years. So thank you for joining us. I am Kaites Elizabeth and welcome to your health updates. So let's get into it. So in our top updates for today, as Uganda continues to respond to the ongoing Ebola outbreak, health officials are defending the country's handling of the situation and questioning the travel restrictions imposed by some nationals. And the Ministry of Health says that science, cooperation plus transparency, not fear, should guide the international responses to the public health emergencies. So Uganda has strongly defended its management for the current Ebola outbreak, pushing back against the travel restrictions imposed by some countries and calling for international responses that are guided by the science rather than fear. So these remarks were made during a briefing for members of the African Democratic Corps in Kampala, where health officials updated diplomats on the country's Ebola preparedness and response efforts. Speaking at the meeting, the permanent secretary at the Ministry of Health, Dr. Diana Atwine, said that Uganda has a long and proven history of successfully managing communicable disease outbreaks and should be recognized for its transparency and effective response systems. So more according to Dr. Atwine, all the confirmed Ebola cases identified during the current outbreak were imported into the country. And she continued to explain that more than 90% of the confirmed patients were already in the institutional quarantine when they tested positive, helping to prevent the wider community transmission. She noted that Uganda's surveillance systems plus the rapid response teams, contact tracing mechanisms, and laboratory networks have played a critical role in containing the outbreak and protecting the communities. So Uganda's history in the communicable disease management is well known, and we shall not shy away from our capabilities, she said. However, Dr. Atwine expressed concerns over the travel restrictions and the advisories issued by some countries following the reports of Ebola cases in Uganda. And she argued that such measures are not always supported by the scientific evidence and could have unintended consequences for global public health. So health experts have long warned that countries may become reluctant to report outbreaks promptly if they fear the economic penalties, travel bans, or the international isolation. So Uganda's Ministry of Health says that transparency should be encouraged and rewarded rather than being punished. Dr. Atwine emphasized that Uganda has constantly shared information with international partners and has maintained a close collaboration with neighboring countries and global health emergencies throughout the outbreak. And she has also called for increased attention to the source of the outbreak, urging that governments and development partners to focus on resources on the affected areas in the Eastern Democratic Republic of Congo, particularly in the Ituri province, where the outbreak is believed to have originated. According to health officials, a stronger border cooperation between Uganda and Democratic Republic of Congo remains essential because of the regular movement of people across the shared borders, the border points. And the Ministry of Health says that enhanced surveillance, information sharing, and coordinated response activities are helping to reduce the risk of further transmission between the two countries. So meanwhile, the World Health Organization Director General Dr. Tedros has repeatedly urged countries to adopt balanced and evidence-based approaches when responding to these disease outbreaks. Now, the World Health Organization maintains that travel restrictions should be based on scientific risks assessment and public health evidence. So the organization warns that unnecessary restrictions can interfere with emergency response efforts, plus them affecting the trade plus travel, and also weaken international collaboration during the health crises. So, public health experts say that successful outbreak control depends on the rapid detection and also the effective contact tracing, community cooperation, and strong systems rather than the blanket travel bans. So as Uganda continues monitoring the situation, health authorities are encouraging the public to remain calm, vigilant, follow public health guidance, and report any suspected symptoms promptly to the healthcare facilities. Officials maintain that the country remains committed to the transparency, regional cooperation, and evidence-based public health measures as it works to contain the outbreak and protect many lives. So health experts say that global health security depends on trust, transparency, and cooperation between the nations. So as Uganda continues its Ebola response, authorities are calling for evidence-based measures that support outbreak control while strengthening international partnerships. Now moving on to our next story. Regional health authorities are closely monitoring developments in the Democratic Republic of Congo, where the Ebola outbreak continues to escalate. Now, new figures show a sharp increase in the cases, prompting fresh concerns about the containment efforts and the need for stronger international support. Health authorities in the Democratic Republic of Congo are battling a worsening Ebola outbreak, while the latest reports indicate a significant rise in the infections and deaths, raising concerns among the health experts across the region. So according to the updated figures from the health authorities, the outbreak has now reached 515 confirmed cases with 91 deaths recorded since the epidemic began. Authorities have also reported 27 new infections in just a single day, highlighting that transmission of this virus remains active despite the ongoing response efforts. And the growing number of the cases has renewed concerns about the potential spread of Ebola within the region and the pressure the outbreak is placing on already stretched healthcare systems. Public health experts say that the latest figures demonstrate that the outbreak is far from over and that continued vigilance is highly necessary to prevent the further transmission. And Ebola is a severe and often deadly disease caused by the virus that spreads through direct contact with the bodily fluids of an infected person or the contaminated materials used by the infected persons. Symptoms may include a fever, fatigue, headache, muscle pain, vomiting, diarrhea, and severe cases show the internal and external bleeding. Now, the Democratic Republic of Congo has experienced more Ebola outbreaks than other countries in the world and has developed considerable expertise in the disease surveillance and the outbreak response. However, experts note that the outbreak is presenting unique challenges and many of the affected areas continue to experience insecurity, population displacement, and also limited access to the healthcare services. These factors can make it more difficult for the health workers to identify the cases quickly and conduct contact tracing, plus providing timely treatment to the patients. Health officials emphasize that early detection and rapid isolation of the infected individuals remain one of the most effective measures for controlling the outbreak. Contact tracing plus community awareness campaigns and infection prevention practices are also critical in breaking chains of transmission. So the increase in cases has promptly renewed calls for international support, and health authorities are urging development partners and also global health organizations to provide additional funding plus technical assistance plus the emergency response personnel and medical supplies to highly strengthen the response efforts. And these also call for enhanced cross-border surveillance plus cooperation among the neighboring countries, given the movement of people across the borders. Health experts warn that strong regional coordination is highly essential to reduce the risk of the virus spreading beyond the affected areas. So countries in the region, including Uganda, continue to strengthen screening measures, disease surveillance systems, and preparedness activities in the response to the evolving situation. And meanwhile, organizations such as WHO and African CDC continue working closely with the national authorities to support the outbreak control measures and also protect the vulnerable communities. Public health officials caution that if the response efforts are not intensified, the outbreak could expand further and potentially become a broader regional health emergency. They stress that controlling Ebola requires a combination of strong healthcare systems, adequate resources, community participation, plus rapid responses whenever the new cases are detected. So as health workers continue their efforts on the front line, authorities are encouraging communities where you're staying to remain informed, report any suspected cases promptly, and follow public health guidance aimed at preventing the spread of the virus. So thus, this situation serves as a reminder that infectious disease outbreaks remain a significant public health challenge, and that continued investment in the preparedness and response systems is essential to protecting the lives. So Ebola remains one of the world's most dangerous infectious diseases. So health experts say that rapid detection still and community cooperation plus strong regional partnership will be critical in preventing the outbreak from spreading further and protecting the vulnerable populations. Now, moving on to our next story for today. So Uganda's Ebola response efforts have been raised and praised from the highest levels of global health leadership during a visit of the State House in Entebbe. The World Health Organization's Director General commended the country's swift actions in managing the outbreak. So Uganda's efforts to contain the ongoing Ebola outbreak have reached international recognition following a high-level meeting between the President Yoweri Kaguta Museveni and the World Health Organization Director General Dr. Tedros Adhanom at the State House in Entebbe. So during the meeting, Dr. Tedros commended Uganda for its swift and coordinated response to the Ebola outbreak, highlighting the country's strong surveillance systems, border screening measures, laboratory testing capacity, and case management strategies. So the WHO's Director General noted that Uganda's prompt action has played a significant role in helping contain the outbreak and reducing the risk of wider transmission within communities and the cross borders. Health experts say that early intervention is one of the most important factors in controlling the Ebola outbreak. By rapidly identifying suspected cases, tracing contacts, isolating infected individuals, and strengthening monitoring systems, countries can significantly reduce the spread of this virus. Dr. Tedros significantly praised Uganda's disease surveillance mechanisms, which have enabled health authorities to detect cases quickly and respond before the widespread community transmission occurs. He recognized the efforts being undertaken at border points where health teams continue to screen travelers and monitor individuals arriving from the high-risk areas. So these measures are aimed at preventing the virus from spreading across national boundaries while maintaining the public safety. So Uganda's laboratory testing systems have also been highlighted as a key pillar of the country's response, and rapid testing enables health workers to confirm cases quickly, allowing the treatment and containment measures to begin immediately. So in addition, the WHO's Director General acknowledged the work of the frontline health workers who continue to provide care for the patients and also conduct contact tracing, educating communities, and also supporting infection prevention efforts. So the meeting comes at a time when the country across the region are strengthening preparedness measures due to the concerns about the Ebola cases linked to the neighboring Democratic Republic of Congo. Now, health authorities continue to emphasize that public cooperation remains essential in controlling the outbreak, and also communities are encouraged to report suspected symptoms early, follow public health guidance, and seek medical attention promptly whenever the signs of the illnesses appear. So, Ebola is a severe viral disease that spreads through direct contact with the bodily fluids, and symptoms include the fever, weakness, headache, muscle pain, plus vomiting, and diarrhea. And in severe cases, a person can get to see the bleeding. Although Ebola can be deadly, health experts say that outbreaks can be successfully controlled through the early detection, rapid response, and also strong surveillance systems, plus the community participation. So this praise from the WHO is being viewed as a vote of confidence in Uganda's public health systems and the country's ability to manage the disease outbreaks effectively. So, as the response efforts continue, Uganda and its international partners remain focused on strengthening surveillance and protecting communities and preventing further spread of the virus. So health experts say that strong surveillance, rapid testing, effective case management, plus community cooperation remain the foundation of a successful outbreak control. And Uganda's response continues to attract international recognition as the efforts to contain Ebola move forward. Now, moving on to our next story today. So today, Uganda celebrates Heroes Day, a day dedicated to recognizing individuals whose courage, sacrifice, and service has shaped our nation. So in our health segment today, we pay tribute to the health heroes whose efforts have helped Uganda fight diseases, save lives, plus building a healthier future. So as Uganda marks the Heroes Day today, we take a moment to recognize not only the men and women who contributed to the country's freedom and development, but also health workers, scientists, researchers, community volunteers, and ordinary citizens who have played a role in protecting the nation's health. So over the years, Uganda has made remarkable progress in the fight against infectious diseases, maternal deaths, child mortality, plus public health emergencies. So these achievements have been made through the dedication of the health workers, plus the resilience of communities across the country. So one of Uganda's greatest public health successes has been its ability to respond to the disease outbreaks. So the country is internationally recognized for its rapid response to Ebola outbreaks through the strong surveillance systems, contact tracing, laboratory testing, plus the community engagement. So during the previous Ebola outbreaks, Uganda successfully contained the virus within a relatively short period, preventing the wider spread and saving countless lives. So Uganda has made significant progress in improving life expectancy, and according to the recent health statistics, the life expectancy has increased from approximately 63.7 years in 2014 to 68.2 years in 2024, meaning that Ugandans today are living longer than they were a decade ago. So the country has recorded major gains in the maternal health, and maternal deaths have reduced significantly, failing from 336 deaths per 100,000 live births in 2022. And this improvement has been linked to the increased access to antenatal care, skilled birth attendants, emergency obstetric services, plus specialized mental health facilities. Child survival has also been improved considerably, and the under 5 mortality has dropped from 90 deaths per 1,000 live births in 2011 to approximately 52 deaths per 1,000 live births in the recent years. So health experts attribute this progress to the improved immunization coverage, better nutrition programs, access to the health care, and stronger disease prevention efforts. So vaccination programs have also made another major success story, and Uganda has maintained the immunization coverage from above 90% for the key childhood vaccines in the recent years, helping protect millions of children from the preventable diseases such as measles, tetanus, whooping cough, and polio. In the fight against HIV/AIDS, Uganda continues to make progress whereby HIV treatment coverage has expanded dramatically, reaching approximately 97% of those eligible for the treatment, while more than 1.3 million Ugandans are currently receiving life-saving antiretroviral therapy. So these efforts have helped reduce HIV-related illnesses and deaths while improving quality of life for thousands of families. So Uganda has also strengthened tuberculosis response, increasing successful treatment rates from around 40% in 2019 to more than 90% in the recent years. And this has also contributed to the better disease control and also improved patient outcomes. So health experts said that this achievement remind us of that heroism is not only found in the battlefields but also in the hospitals, laboratories, ambulances, health centers, plus the communities who were dedicated, also in the individuals who work every day to save lives. So as the country, we celebrate Heroes Day, we honor the doctors, the nurses, the midwives, laboratory technicians, village health teams, researchers, public health experts, caregivers, and every Ugandan who has contributed to building a healthier nation. So their commitment continues to protect communities, prevent diseases, and also give hope to the future generations to come. So as we celebrate Heroes Day, let us remember that every life saved, every disease prevented, plus every health community, this is a result of the countless acts of services and dedication. And to all Ugandans, health heroes, we say that thank you for the commitment to protecting our nation and every individual in the country. Now, moving on to our last story for today. Food is essential for life, but experts warn that when food is unsafe, it can become a serious threat to the health. So as Uganda marks the World Food Safety Day, civil society organizations are raising concerns about the increasing food contamination and also calling for stronger measures to protect the consumers. Civil society organizations have raised concern over what they describe as the growing food safety crisis in Uganda, warning that unsafe food is becoming a serious threat to the public health, household incomes, plus the country's economy at large. So the warning was issued during the activities to mark the World Food Safety Day in Kampala, where food safety advocates called for urgent action to strengthen food regulation, improving the monitoring systems, and also protecting consumers from the harmful contaminants. So the organization, led by Food Rights Alliance and supported by the partners including Action Against Hunger, Fear in Uganda, Caritas Uganda, plus the Global Consumer Center, said that food contamination is increasingly affecting the health and the well-being of millions of Ugandans. According to the food safe advocates, an estimated 1.3 million Ugandans suffer from foodborne illnesses every year. And these illnesses are often linked to contaminants such as aflatoxins, pesticide residues, antibiotic residues, harmful bacteria, and other unsafe substances that can find their way into the food during production, sometimes food storage, plus also the transportation of food. Health experts warn that consuming contaminated food can lead to a range of health problems, including diarrhea, food poisoning, liver damage, weakened immunity, malnutrition, and in severe cases, life-threatening illnesses. Particularly vulnerable are children, pregnant mothers, breastfeeding mothers, older persons, and people with a weakened immune system who are likely to experience serious complications from unsafe food. Speaking during the event, Agnes Chirabo, the Executive Director of Food Rights Alliance, emphasized that access to food alone is not enough if the food is unsafe for consumption. She noted that every consumer has the right to food that is available, affordable, nutritious, and safe. She further called on government institutions, plus businesses, farmers, and food processors, plus traders to take greater responsibility for ensuring food safety throughout the entire food supply chain. So food safety advocates say that unsafe food not only affects health, but also contributes to the rising healthcare costs, plus lost productivity, reduced household incomes, plus increased poverty. The organizations commended that government of Uganda, particularly the Ministry of Agriculture, Animal Industry, plus the fisheries, for taking steps to strengthen food safety governance. And they welcomed the recent restriction and the ban of the 18 highly hazardous agricultural chemicals, describing the move as an important step toward protecting consumers and protecting safer agricultural practices. However, they called for stronger action, including the review and the restriction of additional hazardous pesticides that continue to be used in the agriculture production. The organization also urged the government to accelerate implementation of the key food safety regulations and also strengthen institutions responsible for monitoring food quality and enforcing standards. Particular attention was drawn to the toxin substances produced by the certain fungi that commonly affects crops such as maize, groundnuts, and other grains. So aflatoxin contamination has been linked to liver diseases such as cancer, weakened immunity, and reduced agriculture market opportunities. Experts are calling on a National Agriculture Research Organization known as NARU to speed up the distribution of AflaSafe, biological product designed to reduce the aflatoxin contamination in crops and improve food safety for consumers. So food safety specialists said that addressing the problem will require collaboration among the government agencies, researchers, farmers, food processors, traders, and consumers. They also warned that failure to act could result in worsening public health outcomes and increased economic losses, plus reduced competitiveness of Uganda's agriculture products in international markets. So Uganda joins the rest of the world in observing the World Food Safety Day, and health experts are reminding the public that food safety begins at every step of the food chain, and from the farm to the market, and from the kitchen to the dining table. They encourage consumers to wash fruits and vegetables thoroughly, and also store food properly, observe hygiene during food preparation, and also purchase food from the trusted resources. Health officials said that ensuring food safety is not only a public health priority, but also a critical investment in the nation's future, health, and also economic development. So health experts say that safe food is a fundamental right and a cornerstone of good health. So by strengthening food safety systems and promoting responsible practices throughout the food chain, Uganda can protect lives, improve nutrition, and and also build a healthier future for all the people. So this brings us to the end of today's health updates. So the stories we've shared today remind us about safeguarding public health, and this requires courage, dedication, vigilance, plus also collective action. So whether it is fighting Ebola, or ensuring food safety, or preventing disease outbreaks, or promoting healthier communities, we have a role to play from all of us. From like everywhere we are, from our homes to our communities to the country at large. So, from us here at TV1, we wish you a peaceful and meaningful Heroes Day. And thank you for listening. So stay informed, stay safe, and most importantly, stay healthy. So until next time, let's meet again tomorrow. I have been Titus Elizabeth. Goodbye.
All right, I don't know if you're going to know this next one. I will always remember the day you kissed my lips light as a feather. And it went just like this. No, it's never been better than the summer of what? Ooh. We were only 11, but acting like grown-ups, like we are in the present. Drinking from plastic cups, singing love